Welcome, everyone, to the HeroX Innovation Leadership Speaker Series. I'm Jamie Elliott. I'm joined today by Carla Lopez. Carla has worked with the International Rescue Committee and worked with Harry Sangri, who was one of our guests on a previous episode of the Speaker Series. Carla, it's really great to meet you. Tell us about yourself. Tell us a little bit about your innovation journey.
Thanks for inviting me, Jamie. This has been great. So I started doing innovation work early in my career before I really thought of it as innovation work. And that word has sort of gotten diluted over time. But my background is in global health. And so I was really excited to start my career off doing global health work in places where people didn't have a lot of access to health products and services. And I began my work mostly with an organization called Population Services International. And the reason why I was attracted to them in particular is because their approach was to use local markets as a way of delivering health services and products, particularly around contraceptives and contraceptive health services for women, HIV prevention, malaria prevention, and diarrhea prevention, two of the 5 greatest risks to children under the age of 5. And I thought it was just a really creative way to engage with people by saying, hey, we're going to deliver products and services that appeal to you through the markets where you already engage. And that was a fascinating experience for me. I worked in places like Papua New Guinea and Haiti and Angola and Southern Africa. But what I found was some of the hardest parts about my work was not figuring out how to design the products and services and the operational elements of delivering them, but it was really like getting stakeholders on board with this approach when public health in general is very entrenched in a top-down approach, right? Smoke cigarettes and you will get cancer and die. You don't use a condom and you'll get HIV and die. You don't sleep under a malaria net and you will contract malaria and maybe die. And there's a lot of finger-wagging, which absolutely does not work. Otherwise, nobody would smoke and everyone would sleep under a net. And yet, it's just very entrenched in the way that ministries of health and public health schools, like the ones I attended, really think. So there was this tension between, amongst a whole group of stakeholders who want to do so much good. But there was this tension between a conventional approach to improving health and well-being and, doing things like working through markets to try to achieve a similar goal. And so after several years working in various countries, I decided that I needed to brush up on a new skill set for this kind of approach. So I got to work with an innovation company called IDEO that had just spun off their nonprofit arm, IDEO. They were very new at the time that we worked together. And that's where I really understood how to codify some of the approaches that I had already been using into a methodology that they termed human-centered design, which I'm sure many of your listeners are familiar with. It essentially is a mix of ethnography and experiential work and behavioral science. And it's about really understanding problems from the perspective of people most affected by those problems. So, for example, if you shake your finger in the faces of men and say, use a condom when you have sex or else, and you ignore the fact that people probably have loads of reasons why they choose not to do that, and it's not because they haven't heard about condoms, then you're probably setting yourself up to exert a lot of energy and effort and not meet your targets. So this methodology, again, was an interesting way of approaching innovation. And while at IDEO.org, I got to spend a lot of time working with social enterprises in India and sub-Saharan Africa who were trying to do a lot of the similar things that I had done in the past, which is working through markets and being less dependent on grants and donor funding, and really trying to appeal to the interests of the people they were aiming to serve, which I found fascinating. And that work wasn't just in health, it was also in, designing lighting systems that were off the grid or more efficient cook stoves or financial services for people who were unbanked. And then I took a lot of what I learned there, and I learned so much, back to the more global health world to try to figure out how to integrate some of those principles. And one of the first things I did was I was the country director in Liberia, again, for Population Services International, at the time of the Ebola outbreak there, where it was a complex emergency. Things were changing day to day. I've come to appreciate how important innovation is during times of constraint, right? When you're constrained, you can't afford to do things the way you've done them before. And my approach to innovation in that emergency, for example, didn't follow the idea of sort of this is generally how we do things, but it did sort of that training gave me the confidence to work really closely with the government and say, hey, you have these pre-existing systems of validating health information and communicating it down to the community level that is just not working under conditions in which we're learning new things that change from morning to afternoon about Ebola. So by using these existing systems, we are inadvertently creating mistrust in government because we said one thing yesterday and now we're saying something different today. So we need to change the way we do this in order to really understand how to build trust with communities who we're counting on to contain this devastating virus. So it was a fascinating experience for me to say, like, innovation for me is not about having a handbook and going through these set phases. It's about doing that enough times that you understand what you're trying to achieve in doing that, and then having the confidence and the experience to approach a new situation and understand what elements of that to keep and what needs to shift or change based on your constraints that you're facing. Then I did a lot of work like that before arriving at the International Rescue Committee, the IRC, where I led our human-centered design practice in emergencies around the world and focused on health innovation in particular, but also in education and climate change, and got to work with Harry Sangri, who you spoke to in a previous episode, running crowd-solving challenges in the humanitarian world, which is still really, really new and really exciting. So that was a long version of who I am.
That's a great version. I want to get into the human-centered design stuff. I have another question about problems and how you solve them, how you figure out how to solve them. There's just something I notice in terms of a dichotomy, perhaps. So there's innovation, and what's often, like you said, the definition of the word has become diluted over time, and taken for any meaning as is needed. But it's often used with this idea of disruption and excitement and the new, the better, right? In the public health world, though, innovation is often used for how do we get this thing that's available to some people to be available to everyone else who doesn't have access to it. And we have to use innovation to make something that should be available to most people or all people. Why do you think that is? Like, what do you think the constraints are that say, oh, we have to do this in an innovative way?
Is there an example that you have in mind when you think about this conundrum?
Care coordination for people with access needs, or remote access to healthcare, rural access to healthcare, to basic healthcare services. I worked on one very early on, and it was remote pregnancy monitoring. It was for pregnant women who could not get to the 16 prenatal visits that they're supposed to have, and innovative ways to solve that access problem.
Well, I'm probably talking myself into a corner here by saying this, and I certainly don't want to say that this is true in all circumstances. But one of the reasons why I don't use the word co-creation when I think about my practice, and I don't claim that I'm designing solutions alongside the people most affected by them, is because I think all of us, every one of us, is constrained by what we already know. So our first instinct when we are thinking about a solution to a problem is to think about what do we already know that could solve this problem, right? And so if you're talking to, for example, women in really rural places in South Sudan, for example, who have very limited access to health facilities, and you're trying to encourage them to go to antenatal visits, if you go to them and say, hey, what is your idea for a solution to a thing that you've never done before? It's an unfair expectation of them. I do feel they are the most important people in the room to tell you whether the ideas you're generating are good, right? Do they matter? Do they resonate? Are they of interest? They are the ultimate decision makers on that. So when I hear you say, like, why are we so keen to take an existing problem and open it up to others? I suspect in some cases it's because we go to what we already know. I also think there are situations in which technology is being designed for the largest market. So, for example, one of the challenges we face worldwide in public health is that every time you enter a health facility, whether it's a third-tier hospital or a rural health post, you face a risk as the patient of contracting an infection at that facility. And that's because, more often than not, because of poor hand hygiene. And that is often driven by the providers themselves. Now, if you are in a hospital in Germany, your approach to improving provider hand hygiene is probably going to look very different than if you are trying to do that in a rural health post where there is no water, right? You can't say wash your hands more often if that involves walking 300 meters to go wash your hands when you've got a room full of patients in front of you. And that would mean like breaking eye contact with the woman in front of you to go walk 300 meters to wash your hands and then treat the woman beside her. Like, that's just an unreasonable ask. So in exploring, actually, with Harry Sangri's support, we ran a crowd-solving challenge. I was interested in how we could improve provider hand hygiene without a reliance on water or an additional product that we had to bring through a very fragile supply chain and an off-the-grid solution. And there are great innovations being developed in things like far UVC, right? Using light to disinfect skin. Now, this is emerging, right? It's not currently being used. But my interest there is saying, okay, so there's emerging research happening in this area for this very problem, but it is likely to be optimized for hospitals in, say, Germany, and not for rural health posts. And there's no reason why it couldn't be for both, right? There couldn't be a version for the rural health posts. And there's certainly like enough places in the world that face this challenge of both infection driven by poor hand hygiene and a lack of water or reasonable access to hand washing. And the number of lives that could be saved and the burden of disease that could be lessened is incredible. So one approach to innovation that I am really interested in is how do we influence the development of emerging technology from the very beginning and say, hey, don't forget about us over here. There is a market for us, and the potential for social impact, the potential for health impact is huge. Does that get at your question?
Absolutely. And there's something kind of peppered throughout there that really touches on where my brain was going with it. Because I was asking myself the question too, and I wonder how much of it has to do with markets. Because where's the money, right? And oftentimes, at least in challenge competitions, in these crowdsourcing activities, when it's a government or public sponsor behind the innovation, behind the call to innovation, it's because that public organization sees a problem that the market isn't solving fast enough on its own. And so that public sponsor is not interested in the intellectual property of that innovation. They're interested in solving the problem. And that's not the case with more private focused innovations. I'm curious, when you solve some big problems, sounds like you've worked on solving some really big, hard problems. How do you come up with the idea to test? How do you say this is what we should? Well, where do the ideas come from that you might test to say this is a possible solution? And then how do you say, yes, this is the solution, or these are the solutions we should test?
It's funny. That is a question that comes up a lot. And I think in my experience, the bigger challenge is figuring out what the problem is. I don't know if that resonates with you and the way that you work with your clients. Yeah. So getting people to really define what problem they're trying to solve, and then what the trickle-down effect of solving that problem might be, like how that affects their ultimate impact, has been surprisingly hard, or it is a lot more energy intensive than I think I would have guessed. So what that entails for me is often sitting down with people who know the most about the problem. And it sometimes is a bit of a therapy session, hey, and understandably, where people are like, if you only knew how complicated things are, like in this context, this is hard and that is hard and the supply chains are broken and we have no money for this. And then in the rainy season, the roads are impassable, like any number of interrelated challenges. And to just give people space to be like, what I am doing is hard and I am smart and I know a lot about this. And the fact that I can't solve this problem has nothing to do with my own shortcomings. It's just hard. Like you just need to give people space to really share that experience. So, others can fully appreciate that complexity, but then you have a starting point to be like, okay, so let's look at this tangled problem and say, great. So in the rainy season, roads are washed out. We're not going to be building roads. We're not going to be deploying hovercrafts, right? So let's put that to the side for now. And if not roads, like what is the next thing that is the biggest bottleneck to success? And really going through methodically and with a lot of patience to help people sort of slowly get to a place where they feel like there is one specific problem that, if solved, can play a huge role in achieving the impact they want. And that needs to come from your collaborators, right? From your key decision makers and stakeholders. And then from there, I find the relationship building is how you get to successful problem solving. Because you and I have talked about this before, like innovation can feel very threatening to people who have a large amount of expertise in an area, who have been doing it for years. And basically innovation can signal to some people like, you may have been doing this for a long time, but you're just not innovative enough, which of course is not the case, right? People who have struggled for so long to try to get a gold standard adopted and haven't achieved that, when you come in and say, please divert the limited funds you have to innovation, which is by definition unproven, that's a really hard sell. So I have found that relationship building at the beginning is really critical in order to say innovation is here because what we're doing now is not achieving the impact goals that you have set. So if we continue doing more of the same, we're probably not going to get there. So you get to decide what success looks like, right? You know the most. You get to decide what that is. And then, the innovation, the solution needs to be able to meet your clearly defined criteria for success. So what does it need to prove to you that is worth the risk of you doing that? And that needs to be defined at the beginning, right? Because if you don't do that definition at the beginning, you could come up with 101 amazing solutions or at least early stage ideas. And without an agreed upon and understood set of criteria, what moves forward, what doesn't, what gets tweaked is just really arbitrary, right? What you're trying to sell, innovation, is already a hard sell. It becomes really easy for people to be like, there's just something about, I can't put my finger on what it is, but not quite there. So you're asking how you come up with ideas, but to me, those few steps are imperative. And then once everyone feels good about that, then I think it's time to really dig into something that we don't do enough of in the humanitarian and international development sector, which is say, what has been tried before to solve this problem and how has it fallen short and in what ways did it do well? We have a huge incentive in places where we rely on the goodwill of donors to give us money to do things, to say, we're the ones who are best suited to solve this problem. Give us the money, please, and not all these dozens of other organizations in the same space. So it becomes really difficult to say, hey, that other organization worked on this problem and they seem to be succeeding. Why don't we scale what they're doing? Like, that almost never happens for the most well-intentioned reasons, right? You want to position yourself as an essential organization to social or environmental impactful success. And so it makes it also hard to say, not just what have we tried before and how did that work out, but what has been tried across the sectors? And maybe even look outside of the humanitarian or international development sector and say, you know, in analogous sectors who have been doing similar work, what have they been allowed to do? How does that work? And I'll give you an example of that. Uh, when HIV was really destroying communities in Southern Africa, adult male circumcision, voluntary male circumcision, was found to be 60% effective in preventing HIV among men, which is equivalent to a vaccine. And it's both incredibly impressive as an intervention and incredibly scary for the clients undertaking this, right, as adult men. And so there were these male circumcision clinics that popped up, government and private clinics that popped up all over Southern Africa. There was a huge social or public health push for this. And men were understandably terrified. This was completely new, super scary. So there was a lot of interest in it, but it was still scary. And one of the ways you could think about how to make that experience as welcoming as possible is looking to the hospitality industry, right? What is the difference between a high-end hotel or restaurant and one that is not? How do they make their clients feel, not when they enter their hotel room or sit down at the table, but from the minute they walk towards those doors and there's someone standing there making eye contact with a smile and welcoming them in?
Yeah.
And that's what a lot of us learnt is, how do you make sure that guard that's standing at the gate outside of the clinic, how do you implicate them in the success of that intervention? How do you bring them along and say, I'm a guy, you're a guy, I see what you're doing, and you have a warrior spirit and you're doing a hard thing, and I commend you. Come on in. I'll show you, I'll introduce you to the person at the front desk. She's great, right? And we don't do that. We don't take the time. It feels like a luxury. It feels silly because what we're doing here is serious business. Lives are at stake, you know?
Sure.
And so that kind of work of really saying, how can we learn from what came before so we don't repeat the mistakes of others and we build on successes? And how do we learn from outside of the sector, even sectors that seem, frivolous to the important work that we're doing? That is so critical and so difficult to carve out time to do, people's time to do. And yet without it, we really risk being very inefficient in coming up with solutions that actually have the impact we're looking for. And once we do that learning, then we can have some parameters for what a solution needs to do. What are the characteristics of that solution that make it resonate with the end users, that are fit for the operating environment that we're working in, that don't repeat the mistakes of the past. So we have the parameters that solutions must conform to, but the solutions themselves could be any number of things that conform to that sort of brief that I refer to it as solutions brief.
I saw a similar example where a hospital had hired an artist to paint the scene around and the opening to an MRI to look inviting for a child, because it is just this incredibly scary environment to walk into, right? And it's scary for everyone. And so to make something more welcoming, but it's a non-traditional thought, right? Like engaging the security guard in that way, or making your security guard higher, make that an important part of their role, to understand the role that they're actually playing. You're the first face someone's going to see when they show up to maybe do this, right? If they're on the fence, they might not. You mentioned asking donors for money, and we had this come up in another speaker series episode. There's when you want to be truly innovative, but you're doing the public goods work. So you are reliant, because the market may not be funding your work. So you're reliant on donors' money to go make this innovation happen. You're saying, hey, we're the best ones fit to do this, but also we're probably going to fail a lot when we try to go do it. So how do you wrestle that with making those that are putting the money up want to solve this very hard problem, probably don't understand the problem as well as your subject matter experts, but have some degree of risk aversion because they are putting their money up to solve this problem. How do you address, or how do you think about introducing that idea that, hey, we're probably going to fail? This is how we'll try not to fail as much, but we're probably going to fail in trying to solve this.
I find that donors have more of an appetite for risk than colleagues often do. I think that in many cases, this scarcity mindset, this idea of like, we have so little money and the problems are so big and so important, really entrenches risk aversion into, colleagues across the sector. Because, understandably, if you're saying, look, women who rely on us for contraception, if we don't get donor funding and our services end, then they're no longer protected, right? Or if a child's being treated for severe acute malnutrition and they will die without the treatment, and we have to close our doors, as many doors were closed this time last year, they could die. Like, the stakes are really high. And so there are two challenges that colleagues face in delivering life-saving work or work in the interest of the well-being of people. One is this idea that, like, we need to keep doing what we're doing because there can't be any gap in services to the people we want to serve. And the other is everyone is doing 3 jobs. Like, literally everyone is doing 3 jobs. So if you are running around like a headless chicken, just trying to keep things going, does anyone, particularly people who are most experienced in the problem we want to solve, take that moment to step out and say, what would it look like if we did this differently? And donors, on the other hand, often when they put out calls for proposal, are asking for innovation. They're asking for new things. They want to be the ones funding the new thing. They want to be the ones to be like, we invested in this thing that just cracked things open, and then we were able to leap ahead rather than have this like incremental progress. But there's a disconnect between a call for proposal goes out, you have X number of weeks to submit your proposal. The proposal needs to be internally vetted by all the experts and the country teams running it and this, that, and the other. Like, it is just an impossible system for anyone to come up with innovative ideas in that proposal. Oftentimes you end up having much smaller, well, this has been my experience, hey, much smaller scale grants directly from donors to fund an innovation. So that's something that they have already decided, like, we trust you, we have a relationship with you, we're willing to give you money to do this. And there are a couple scenarios for that. I've been lucky to get funding from very forward-thinking donors to do exploratory research and say, okay, we want to solve childhood malnutrition. Everybody knows how to treat malnutrition. Solving it is or preventing it is a whole other issue. It's a very sort of nuanced, you can have 2 children in the same household, one who's severely malnourished and the other is not, and you won't necessarily know why one is and why isn't. So it makes the communication to families very tricky because what do you tell them, right? So that was an argument for exploratory human-centered design work and say, we're going to be very expansive in our thinking. There's no single solution to this, right? But we're going to engage with communities, with providers, with other people working on this problem to think about, what does it look like if you think about it from an agricultural perspective, or when you think about it from like ensuring that women are not having babies when they're babies themselves, because that leads to low birth weight children, and low birth weight children have a higher risk of being malnourished as they're older, right? So thinking about it as expansively as possible, and then generating ideas that are not meant to be perfect. They're meant to just sort of come up with as many ideas as possible so that we then have fodder to mix and match those ideas, to refine those ideas down the line. But we're not starting like with a presupposed solution. Donors have been surprisingly excited about that, because this idea of having like a bank of ideas that come out of this, even if they're very early stage, even if we know they're flawed, it doesn't feel so much like a failure, right? It feels like this is better than starting from a blank page, is to start from
Right.
this. And then with challenges, which are intentionally much more focused, right? I mean, I I think that funders who truly understand what innovation is realize that a failure is an example of a huge lesson, right? It could fail to reach your intended target, but you learned so much in that process. And as long as you set up conditions for people to talk wildly about what actually happened versus what they hoped would happen, then that's adding to sort of the community of practice, the community of knowledge to say, okay, well, here's what we would do differently this time, or here's what others could try doing differently so that they're not repeating this mistake.
Well, Carla, I know we're just about out of time. This conversation will need to continue. We'll have to have a part two. If it's okay, I'd love to put your LinkedIn in the description for this video. Is there any other place you would point folks to learn about your work and other things, other ways they can get involved?
Love to hear other people's experiences and whether what I said resonates or people had a different experience. I mean, thank you for inviting me to this. I really hope it opens up more conversations. And yeah, if people know what I'm talking about, it would be nice to hear that. And if people have an idea about how we could do things differently, that would be very exciting also.
Agree 100%. Thank you so much for your time, Carla. This has been very, very insightful and excited about what comes next. Thank you so much.
Jamie.